Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, some of the highlights. Today, Abia State Governor Okezie Ikpeazu tests positive to the coronavirus as state records more cases in 24 hours. Cross River State remains COVID-19 free. The state government commissions 100-bed space treatment center. And from today, most people arriving the United Kingdom are expected to quarantine for 2 weeks as country reopens its airspace. The number of coronavirus infections in Nigeria stands at 12,486 after the Nigeria Center for Disease Control (NCDC) announced 260 new cases of COVID-19 in 18 states of the Federation and the Federal Capital Territory, with 3,959 discharged and 354 deaths recorded. Of the 260 new cases, Abia State tops the list with the highest number of cases at 67, followed by the FCT with 40, Lagos 38, Ogun State 19, Gombe 16, Edo State 14, Imo 9, Kwara, Katsina, Nasarawa and Borno States 8 each, Kaduna 6, Bauchi 5, Ekiti 4, 2 each in Niger, Ondo, Plateau, Kano and Sokoto State. A breakdown of the regions show Lagos State in the southwest still remains the epicenter in Nigeria with a total of 5,767 cases, followed by Kano in the northwest with 999 cases. The FCT leads in the north central with 952 cases, while Edo leads in the south-south with 401 cases. Borno tops the northeast with 356 and Ebonyi in the southeast with 103 cases. The governor of Abia State has tested positive to COVID-19. The governor was said to have presented himself for the test after 2 of his aides were diagnosed with the virus. Governor Okezie Ikpeazu, whose second COVID-19 test returned positive yesterday, said that his decision to present himself for a second test was to remove all doubt about his status after testing negative initially. He assured the people of Abia State that he remained stable and in high spirits, saying, "As your governor, I have a responsibility to do what is right and keep our people fully updated about my health status." He restated his stance that testing positive to the virus is not a death sentence and appealed to the people of the state not to panic but to continue to take issues surrounding the COVID-19 pandemic with seriousness and take all necessary precautions in line with the protocols enunciated by the NCDC. The governor has since commenced self-isolation while directing that the deputy governor, Sir Ude Okochukwu, shall hold the fort in his absence. Cross River State government, in collaboration with the Coalition Against COVID-19, CACOVID, has commissioned a 100-bed space treatment center in Adaibo community area of the state to help fight the spread of the pandemic. Speaking at the center, the Commissioner for Health, who doubles as the chairman, Cross River State COVID-19 response team, Dr. Betta Edu, says that the isolation center is well equipped with an intensive care unit, a laboratory, ventilators, medical equipment to support the fight. According to her, this is the 3rd isolation center in the state.
Cross River State, as it is now, has 3 isolation centers. One at the University of Calabar Teaching Hospital, another at the General Hospital Ogoja, and this big isolation center here in Adiabo. This isolation center has 2 big wards and several private rooms for VVIP clients. The big ward, which we're in right now, is the male ward, and it carries about 70 beds. And then we have the female ward down the stairs, which has about 30 bed space. This decision was based on research and the fact that more men have actually had the COVID-19 disease than women. Beyond that, we have a very beautiful ICU, that's intensive care unit, with ICU beds, oxygen concentrators, ventilators, oxygen cylinders, respirators, amongst other things. This facility also have a lab, a side lab, where we can carry out the basics for our people.
And in a bid to develop indigenous technologies in response to the COVID-19 pandemic, Kaduna Polytechnic has designed and developed process plants for the production of medical oxygen and sodium hypochlorite. At a news conference, the rector of the Polytechnic, Professor Idris Bugaji, says that the medical oxygen could supply medical oxygen promptly and sustainably to all the respirators being operated in Nigerian hospitals, while the sodium hypochlorite is a good agent of fumigation to cleanse surfaces and the environment of infection. He explains that the Kaduna Polytechnic management decided to set up a technology response team to COVID-19 domiciled at the Center for Technology Development of the Polytechnic to address the technological gaps in the responses to COVID-19.
We set up a technology response team to COVID-19 made up of our lecturers and engineers who are engaged in different areas of technological innovations. So here we have the complete design of a plant that can produce hospital oxygen from the air that we breathe. So the raw materials are available everywhere, all the time. It has to be of high purity. And that's why a number of unit operations are incorporated so that we'll be able to get the purity of 99.9 or thereabout as required by hospitals. And this is a project that can be realized with a research fund of only 50 million naira. And we can be able to replicate this after the first plant is completed and commissioned. We can replicate more plants for all the geopolitical zones or even states of Nigeria. The second one was on sodium hypochlorite, whereby the table salt, which we call sodium chloride, we take it into an electrolyzer, we do electrolysis, we separate the sodium from the chlorine, and then we react the sodium hydroxide that forms with the chlorine gas, and you produce sodium hypochlorite. Now, sodium hypochlorite is a liquid form, and therefore is easy to handle, and is the major disinfectant against bacteria and viruses.
Another survivor of the coronavirus disease, Mr. Kehinde Adegbulugbe, has been recounting his experience and advocating that Nigerians stick to the prevention guidelines. He explains that some of his symptoms included a lack of taste and smell, a searing pain in his chest for days after his exposure. He was speaking on our breakfast program, Sunrise Daily, today.
Across board, I think the loss of smell and taste also is a very, very key indicator. I've not had the flu in years. It's not something I have. So when I had it, I knew it had to be COVID. For me, if I took in a deep breath, I started feeling pain. Pain in my chest, pain on my back, my right shoulder. I was having fever. Not that much fever, actually, not that much. It was actually breathing that got worse. The isolation center, I was there for 15 days. And honestly speaking, it was an unbelievable experience. The federal government of Lagos State is doing a fantastic job. It was beyond my wildest imagination, actually. When I got in, I was placed on oxygen. The one they call an oxygen concentrator, which is electric. So that means there has to be constant light, and there was. The nurses, the doctors, the technicians, the cleaners were fantastic. They came in every time to clean. The technicians came every time to check your AC, check your oxygen, check how you're doing. They actually kept the higher standards. And It's unbelievable because they gave us 3 square meals. Quite unbelievable. As a diabetic, I was worried about how eat food that is for diabetics, but they actually had that arranged. As I'm driving out of Bagada, going to my house, I'll see people social distancing, I'll see people wear masks, I'll see buses half empty, and my journey from Bagada down to where I stay, I was looking out for it, but I didn't see it, and I was like, my God, is it that these people don't understand that this thing is real, or what's going on through their minds?
So a survivor there recounting his experience in having also survived the monster COVID-19. Well, to date, there are no specific vaccines or medicines for the virus. Treatments are under investigation and are to be tested through clinical trials. However, over the weekend, scientists say the injection of cloned antibodies could help treat people already infected while vaccine development continues. Well, what does this mean? We have Dr. Adirunke Olowu. She's a pharmacist and she joins us on the program via telephone. I'd like to welcome you to the program. First, tell us, because we're hearing Kaduna Polytechnic with new productions, 2 new products, the medical oxygen and the sodium hypochlorite. How does this production help in the battle of COVID-19?
Hello, good afternoon.
Good afternoon, Dr. Lowe. Thank you for joining us. I was asking your thoughts with the new inventions, production of the hypochlorite and the medical oxygen, and how that is important to fighting COVID-19 in Nigeria.
Well, any new development is a welcome idea. Anything that will help to improve and allow people to recover fully is always welcome in the fight towards this pandemic.
Let's quickly get your attention, your point of view. We heard over the weekend that the injection of cloned antibodies mean that, how does it help treat people already infected? They say this is a new development, while, of course, the development of vaccine or the race for a vaccine continues.
Well, this is a viral infection, and usually people infected develop antibodies that helps them to fight against reinfection, and that's the basis of development of vaccines. Because if we have good antibodies developed from recovered patients, we can harvest, and it will help in the process of developing vaccines that will be used by the whole population. So having it cloned, of course, it means it's going to be available, readily available, which we can give to other people, whether they are infected or yet to be infected. So the development of the cloned antibodies, provided all indications say that it is safe for human use, will also be a welcome idea in the fight towards eradicating COVID-19.
Dr. Lowu, the clinical presentation of the virus varies from patient to patient, we've been told, and there is the understanding that the individual genetic susceptibility to the disease is vital for the prognosis, prevention, and the treatments. But looking at our death toll in Nigeria, how are we handling things?
Well, if compared to other countries, you agree with me that the death toll in Nigeria is low. However, it might be due to many people not doing enough testing. But for those that we have tested, and for us to have a high number of recovered patients, it means we are really doing well. The presentation varies from patient to patient. That is why we have a symptomatic approach to the management. And usually those with comorbidities are the ones that require more attention medically. Those with mild and moderate symptoms, we can still manage them without going through all the clinical interventions. But those with underlying comorbidities are the ones that are major concern to us. So it depends on the manifestation for each patient, the variations that will be the clinical interventions.
All right, we appreciate your time. Adironke Olowo, a pharmacist, thank you for joining us on the program. Still to come on the COVID-19 updates, we take a look at the global response to COVID-19, also community transmission and how we're working to curbing the spread in Nigeria. Stay with us. Welcome back. Dr. Shalom Oni is a public health physician and he joins us here in our Lagos studio. Good to see you, Dr. Oni.
Thank you, Millicent.
All right, looking at the relaxation of lockdown, especially in Lagos, what were some of the things you observed this weekend?
Over the weekend, a lot of people were excited that, churches are now allowed to open up and they can now fellowship. You know, there's this bonding when you are together in a church service. So, but then from what I could see around, there has been some degree of compliance because churches have been scanty. Most churches are operating online. I think that culture of online service that has been ongoing for about 2 months now, it's even difficult for some people to change. So I've even seen some pastors who came out and say, members, please stay back at home. We are not ready for you yet. Some churches are already putting things in place, infection prevention protocols, studying the guidelines, by the Lagos State government and seeing what they can do, providing sanitizers, thermal scanners, looking at how they can do social distancing in the churches, looking for how they can create other centers where they can beam live services to. So over the weekend, I think churches were scanty. People are still afraid. They are not yet gotten used to the reality of, okay, now we are using lockdown, we are coming. So some degree of fear, whereas there are some other churches who are bold enough and said, yes, we are ready for you, you can come over. Yeah.
So we're told we're still in the community transmission stage. What happens when someone presents to your hospital, for example?
Now, let me approach this in two categories based on what happens at the isolation centers, because we can call that an hospital also. Now, at the isolation center, it's very simple. The normal ward rounds that take place with the doctors, with the nurses, and even the normal cleaning protocols that take place with the health attendants. So you see the nurses coming in the morning to you in the morning, asking, doing your vital signs, your blood pressure, your temperature, all of them fully kitted with full PPEs, taking things down, jotting things for you, then serving you your medications. Then you see the doctors coming around also kitted, attending to you. It has been friendly, at least from reports I've gathered here and there. It has been friendly, they listen to people, the isolation centers, especially in Lagos, they've been fantastic. So that's what I would say, normal thing that happens at other hospitals, other normal hospital days. Now, going back to the government hospitals now, the teaching hospitals, the general and the primary centers, the infection prevention protocol is there. People have been asked to observe it, and it's ongoing. Though you need, a lot of funds and resources to be able to sustain protocols like that. So people coming to the facilities, wearing face masks, washing their hands at the entrances, using hand sanitizers. These are things that have been going on. The health workers also, many of them on face masks and things like that. But like we have always said, this thing is a marathon. You need supplies to be able to sustain this level of infection prevention protocol such that spread will be minimized and curtailed.
Looking at the overall epidemiological report of Lagos State, what are your deductions? Because we see that Lagos is still the epicenter. It's recording a number of cases, and last week, for example, we saw Lagos topping some of the new infections, and then we're looking at, just like yesterday, it just had 38 cases.
Yeah, going by the epidemiological report, really, number one, we want to look at how well are we doing in terms of information communication and behavioral change as far as social distancing, face masking is concerned in Lagos. I still go around once in a while in public vehicles. I see individuals who are not putting their face masks. Sometimes I tap them. I say, hey, your face masks, because I'm putting on one.
And what do they say?
Fair enough, 50-50. Some of them just look at you and, they look away. Others just, adjust immediately. So that culture must not be lost, must be sustained. That's one, because the cases are rising every day. In fact, there's this a case of or an idea, or it is being mooted that some of the cases that we're even having, they are not really the daily case. They are backlogs of some of the tests that have been done. So, because you see people calling around and say, hey, I've done tests for a week now, I've not seen my results. I've done tests for 10 days, I've not seen my results. So, you want to see that maybe even what we're even seeing daily might not be the actual picture. That it might be more than that. But however, the culture of face masks must not be lost. The culture of social distancing must not be lost. Then the issue of gatherings at the motor park centers, in markets, we still look for a way to regulate the market gathering too, because a lot of transmission is going on there that we are just overlooking. So these are things, we need to look into as far as the epidemiological report is concerned, to inform us and say, hey, what can we still do to ensure that, we are doing well and we're reducing transmission. Another thing we need to do to also ensure that the cases are reducing is to increase the testing time, to make the testing kits available, to also ensure that those cases that are positive are immediately evacuated to isolation center. Now, there's the issue of isolation centers being filled up, but I like what Coalition Against COVID they are doing. They are providing more isolation centers. So maybe more private sectors need to come in and help the government to assist, in providing more isolation centers so that cases can be evacuated on time to the isolation centers. That's another thing that is key. So testing, releasing of result, evacuation, the culture of face masking, health education, some people think that COVID-19 is a scam. In fact, more people now are saying it's a scam. So we must keep on engaging the people, because if you don't engage them, there's a gap.
Okay, we'd like to thank you, Dr. Shalom Mani, and wishing you all the best and safety as well as you continue to fight the pandemic on the front line.
Thank you very much.
And as the UK border staff prepare to impose nation's first blanket quarantine scheme, opposition is growing to the Home Secretary's plan for 14 days of self-isolation for most arrivals. Passengers in UK airports, ferry ports and international rail terminals will be required to self-isolate for 2 weeks. A new law applies to returning British travellers as well as foreigners. So far, more than 7 million coronavirus cases have been recorded globally, with over 3.1 million people recovered. And sadly, 402,894 others have died.
People on arrival to the country, travellers entering the UK will now be required to self-isolate for 14 days as the government attempts to thwart a second wave of coronavirus. Those who fail to comply could be fined £1,000 in England. New Zealand says it has eliminated transmission of the coronavirus and will lift all containment measures except border curbs. Prime Minister Jacinda Ardern says the government will drop social distancing restrictions from midnight as it moves to a level 1 national alert from level 2.
It's been 40 days since the last case of community transmission, 22 days since that person finished their self-isolation. And so today, I can announce that Cabinet has agreed we will now move to level 1 to get our economy fully open again, and we will start almost immediately. We are not immune to what is happening in the rest of the world.
China's National Health Commission says no new domestically transmitted COVID-19 cases have been reported on the mainland. Health authorities say only 4 imported cases were reported, 3 in Sichuan province and 1 in Shanghai. The COVID-19 death toll in the United States has surpassed 110,000. That's according to the Johns Hopkins University. The country has over 1.9 million confirmed cases. Meanwhile, restaurants and shops are back in business as Jakarta eases virus restrictions. Businesses are now allowed to reopen as part of a loosening of restrictions in place since late March to contain the spread of COVID-19 in Indonesia.
And from the NCDC, while they work to provide Nigerians with verified information on infectious diseases, the NCDC team continues to monitor misinformation on COVID-19. The centre says you can help out by submitting rumours on its new reporting platform. Their website has all the information and statistics on cases across states with regular updates on COVID-19 regulations and guidelines. From the World Health Organization, you'll find the Coronavirus Disease Situation Dashboard. It's an interactive map. It provides the latest global numbers by country of COVID-19 cases on a daily basis. The website has rolling updates as well on the pandemic. And of course, our website, channelstv.com, has the latest news. All you need to do is log on and access news in health, politics, business, sports, Africa and around the world. channelstv.com, that's the website. That's the COVID-19 update. Thank you for watching. I'm Millicent Walker. Bye for now.